Greetings and salutations. You see, folks, I'm in my Miss Lou head tie today. I decided to honor my roots because I am know that this is an issue that needs to be rooted and grounded in our reality as a people. So you're not seeing me, but you're hearing me. And because I don't think I need to be seen. But what I want to say is we have two great people here to lead us in our conversation on the matter of mental health, human health, to kick us off on our second day of healthful economy. We're talking about how do we ensure that our people are healthy. I guess I should show up my face a bit. Yes, I do have on my head tie. I gone again, as cousin Clara would say. But let me introduce our moderator for today, and it's Christine Newton. She is with the Cabinet Association of Georgia, and they really set the bar last year on really bringing mental health to the fore and trying to ensure that we as a Caribbean people sort of get out of the shame treeness. You know, we have this big shame tree. Get out of the shame of talking about mental well-being, mental health in our family, and the embarrassment that we normally deal with it. We want to really move away from that. And we started this work last year in working with Cabinet Association of Georgia. So I'm delighted they're back and that Christine Newton is here to help guide this conversation with our guest, Colena Brown. So with that, I turn the floor over to Christine to introduce our guest and to manage the question and answers that will follow. Thank you.
Good afternoon, everyone. Um, this is Christine Newton, and mental health is one of those subjects that I am truly interested in because, one, I have an autistic individual in my family. Two, I help a lot of special needs individuals with mental health, bipolar disorder, etc. And so this was an interesting topic for me to host today. I'm going to introduce Colena Brown to you, LPC licensed professional counselor in the state of Georgia, founder and CEO of Realizing What Matters, a behavioral health supporting services company. She has a Master's of Arts in Counseling from University, a Bachelor of Science in Psychology from Georgia State University, and an Associate of Arts degree in Psychology from Palm Beach Junior College. Kalina prides herself in not only spending time securing academic training, she also believes that her personal experiences add to her ability to be present in each of her supportive roles. Over the past 36 years, these roles include private practice as a cognitive behavioral therapist. She supported numerous patients in developing healthier methods of processing the world as social worker, organizing and carrying out projects for family reconstruction as it relates to homelessness, grief, and family violence. Most recently, 2017 to 2020, she moved to Guyana, South America, to work with Ministry of Public Health as the senior psychology of the country. In this role, she was tasked with developing the policies and procedures for the country's mental health system. Kalena's commitment is to be a part of the movement that demystifies mental health, simplifying and reframing assessment, testing, and diagnosis, establishing a safe space where people can begin to use healthy tools to heal at the clinical level. The clinical level is where the trauma of life lives. Finally, she remains open to opportunities to be of support, standing in the gap, and positioned to be present. Change doesn't happen until change happens. That's a quote from Kalina. And with that said, I'm going to turn it over to our expert, and you can ask any questions at the end of this session. Go ahead, Kalina.
Thank you so much, Christine, and good afternoon to you and to everyone within the sound of my voice. I thank you for that very thorough introduction because I've been in the field for so long that I sometimes forget. So I get excited sometimes when I remember that I have been doing this for quite some time. Excuse me. It's truly my passion. I started college in 1979. However, I was introduced to psychology in the ninth grade. And when I first understood the process of psychology, I was excited because I think I was much like a lot of people I've met since then, had some traumas already in my life as a very young child, and did not know that there was even trauma. I was experiencing it as just that, a life experience. And in ninth grade, when I took the psychology course, it began to open up worlds to me that I just never knew. And I was hooked because just that one course led me into doing a lot of my own research and a lot of my own readings. And I began very early in my life to understand that mental illness is nothing to be ashamed of, that mental illness is a process of a happenstance. And what I mean by that, for most of us, there is a traumatic experience that happens, and it oftentimes happens in our young developmental years. And for a lot of people, especially people that look like you and I, Christine, that live in a community where there is an abundance of shame from several different directions, we were not given the opportunity as young people to even have a forum by which we can have a conversation about some of what we may have been experiencing. I know personally, I didn't have words for it. And so in studying psychology, the words began to develop. I began to realize that there is a method to the madness. I began to realize that shame has nothing to do with it. So I've spent a very large part of my life educating myself and exposing myself to the understanding of what mental illness really is. Because personally, I've been diagnosed with depression and anxiety since my very early 20s. And I oftentimes use myself as an example to say, I'm pretty much productive. You know, some people might say a little tilted on one side or another, though the truth of the matter is that mental illness is not a death sentence. It is not a thing that we should not want to help ourselves with. Sadly enough, in our community, we have been given the idea that mental illness is something that only crazy people deal with. And I'm not even sure in all my research where the word crazy comes from, because it's not a true diagnosis. It's a term that has evolved and for the most part has been a barrier to people seeking out mental health. And which then leads us into staying in a mental illness status for far too long than we have to. So if I were to start from a beginning point, it would be to help whomever is listening and whomever may be interested to understand that mental illness has several forms and it has multiple layers in the form. And it's not unlike any other disease. It is a disease of the brain. In my private practice, I worked with several different people. And one of the people that I think about the most is a psychologist. She has a PhD in psychology, and she is a current practicing psychologist that teaches at Spelman University here in Atlanta, Georgia. And I think about her often. I talk about her often because she called me for 5 years before she set up an appointment. And she was referred to me by a mutual friend. And the friend would check every now and then and say, well, has she ever come to see you? And I was like, well, she scheduled an appointment, though she canceled it. And after about 5 years, she finally kept one of her appointments. And when she came into the appointment, she said to me, and it's a statement that I repeat as often as I can. She said to me, she said, Colena, with my academic achievements, i.e., she has a PhD in psychology, she said, I have been able to find creative ways to hide in my life. I want to say that one more time. She said, I have been able to find creative ways to hide in my life. And when I first heard that, I had to think about it. However, Christine, doing our conversation, doing our sessions, doing her therapy, I got to understand exactly what she meant. What she had done was what a lot of us do. She found ways to justify, she found ways to minimize, and she found ways to convince herself that really she had no problem. With all of the training she had, with all of the accolades that she had acquired, she still too had this shame about mental illness. And doing our 5, 6 years, and that's how long we worked together in the sense of her being the client and me being the therapist, we discovered so much information that I currently share as often as I can, because if with her understanding of psychology, her understanding of what a brain disease is, shame still overtook and took her 5 extra years before she even made the appointment. I want to say to everyone that that is the first thing we have to overcome. We have to begin to understand that when we talk about the brain, that is the powerhouse of who we are. That is where we really live. And I don't know everyone's spiritual connection or where you are when it comes to spirituality. However, for me, if I were to think about the soul, because in my belief system, there is a soul, then I would want to think that the soul exists in the brain because the brain is where we live. And so we're actually talking about finding a way to bring peace and comfort for our souls. We want to find a way that our brain can be healthier, because the brain is what conducts, directs, manages all of who we are. And so she even said to me, I feel a little bit more comfortable when I think about it as a brain disease. And I said, okay, we can call it that. We cannot even say the word mental illness or mental health anymore. And so a lot of times now, even when I'm doing talks and when I am sharing, I want to be able to say, we're talking about having a healthy brain. And one of the things that causes our brains to not be healthy is trauma. And as I said earlier, it is usually trauma in the very early parts of our development. And oftentimes it's not even overt trauma, because trauma is trauma is trauma. And what's traumatic to one person may not be traumatic to the other person. And trauma is not weighed. One trauma is not heavier than the other, and one trauma is not even worse than the other. Trauma has to do with an interruption in the developmental process of the brain in the very early parts of its development. And if we could begin to think about it in that way, I believe, I've spent several years coming to this conclusion that we may be able to break some of this resistance to getting the help that we need to give ourselves the opportunity to have the healthiest brain possible. I think for most people, they want to be healthy. We have all kinds of dental health. We have all kinds of physical health, exercise, diets, all of these things that are very common and we talk about at gatherings and we talk about it in social events. We talk about it at work. Whew. The moment someone mentions mental health, everybody shuts down. Nobody wants to talk. However, for as long as I live and breathe, I absolutely, positively want to be a part of the conversation that demystifies mental illness, the conversation that becomes a part of the community's conversation, the conversation that is void of shame, the conversation that has nothing to do with blame, the conversation that says that there's nothing wrong with you, the conversation that says you're not less, you don't have anything that you have to fix. There's nothing that you have to hold your head down about. I want to be a part of the conversation that gives the information that begins to help us understand the importance of being healthy when it comes to brain power. That's where we live. I want it to be where in our homes, we begin to talk about it to our children. In our homes, we begin to talk about it amongst the adults. I have a project that I'm working on for Guyana where we are going to do what I call the door to door, where we're going to take information, just a quick and dirty one-page sheet that begins to help people understand the very basic symptoms of mental illness, the things that we may take for granted as we see it ourselves sometimes, and if we see it in our families, that we begin to recognize it. If we have a family member that's always sneezing, that's always coughing, definitely that has a fever, we know those symptoms to be problematic. We know that those symptoms could be a cold, it could be the flu, it could be pneumonia. And then we're going to seek to help that family member get some professional help. I want mental illness to become just that commonplace, that we understand it well enough, that we can see the symptoms early enough, that we can begin to become comfortable enough that we then are able to help ourselves and or help our family members. So I've said a lot because it's in my head. I don't have to write anything down. I understand it because I live and breathe it. And I believe that change doesn't happen until change happens. So, Christine, if there are any questions or anything anyone wants to add or talk about, I'm very open.
So one of the things that you mentioned was healthy brain. I mean, say someone growing up and so forth, and they've had trauma, and at some point they, visit a doctor like yourself. How do they develop or start to develop a healthy brain?
Okay, and that's a very good question because there's a confusion out there about mental illness, and I'll use this term that's not frequently used anymore, mental retardation. And they call it now mental disabilities. Okay, mental illness is just what it says. It's an illness. It's a sick brain. It's a brain that's been changed by trauma. Mental retardation or developmentally disabled, that's very different. A mentally disabled person or mental retardation means that the brain has been broken beyond repair. And a very easy way to understand it is if someone could be mentally retarded. There are, again, several levels of mental retardation, mild, moderate to severe. You can be mildly mentally retarded. That has to do with the the physical structure of the brain not fully developing properly. So you may never get past the capacity of a 2-year-old, and you continue to age, but because your brain was broken, you're going to always behave on a 2-year-old level. That's not mental illness. That is not mental illness. Mental illness, on the other hand, is a sickness which is treatable. And the way that a person comes into a therapist, they have to get an assessment, which is, of course, questions and understanding. And then the professional, we have learned what the norms are. There are benchmarks. There is a place where we've agreed upon that is a healthy range. Like, take, for example, I think all of us agree that we know that most 5-year-olds can't drive a car. That's not within a 5-year-old's capacity. Now, that 5-year-old might think he or she could drive the car, but we know enough to know they can't. And so that's the same way you think about understanding brain disease. When you talk to me, I'm listening to hear where you are as it relates to, let's just say, the charts, where you are as it relates to the norms. And then I have the ability to make an assessment, and I can diagnose throughout all of the mental illnesses that they are, which one close enough fits what I'm getting from you. Go to the doctor, your throat hurts. You may have a tonsil problem. Go to the doctor, your foot hurts. You give them enough information, they can figure out what part of your body they need to focus on. You give me enough information, I can figure out what part of your brain we need to work on. Does that make sense?
Yes, that makes a lot of sense. That really does. So it would be helpful to seek out professional help. But you know, how does one recognize that? And this is a lot in the Caribbean community and so forth. They'll just brush it off and say um, nothing is wrong with them. They're just this way or they're just that way. But how does one, walking around, recognize I need to go seek special help? Because some people just don't recognize that they need that specific help. How do they recognize that? Like, I need to come out and see it.
Okay, and that's, again, a good question, because that is probably the catalyst that keeps me going, is to be a part of the movement that gives that information. As I said, that one project I'm doing door to door, I think it has to do with what I call psychoeducation. We have to be educated in the symptoms. What has happened is that I think we all know people in our lives, families, friends, neighbors, and then we all know ourselves. However, what has happened is that we've given particular behaviors layman's term. I always use the word lazy. Oh, he just lazy, okay? And I say, help me understand what you mean when you say he lazy. He don't like to get up in the morning. He always dragging. He don't even like changing his clothes. He'll wear the same clothes every day. He won't clean his room, and he sure don't like to eat. We gotta make him eat. He don't like no food. Every time I sit around, he just sitting in the corner somewhere. He don't want to do nothing. That sounds more like depression to me than lazy. And if someone doesn't understand that those particular behaviors could be something clinical, then we're going to always call it lazy, and we're going to never get that person any help. And a lot of homeless people end up on the streets, not because they're lazy and no good and don't want to keep a job. It's because they've been mentally ill for quite some time, and their family get tired of them. And sometimes they get put out the house, ran out the house, shamed out the house, and then they really get no help. So it's the everyday situations that we find ourselves in. You can talk to me about anybody, and if it is a consistent behavior over a long period of time, or a certain period of time, I can probably tell you it might be this, it could be that. Then I would have to meet that person and do a more intense, and that age of about probably 4 to 5 to about 90 to 95, because we live sometimes and never get diagnosed and never get help, and we struggle with mental illness issues and never get it labeled properly. So it's everyday treatment.
Wonderful. Thank you for answering that question. Another question I had, and this is something that I realized after taking my son to the doctor and so forth. Just like there are different types of, say, like dentists, like they have dentists for this, they have dentists for something, something else. They have a doctor for your stomach. They have doctors for your eyes. I've realized there are different types of psychologists that specialize in different types of things.
Absolutely.
So, say an individual, okay, they're ready to seek help. How do they know what should they do to seek out the right psychologist for their problem? What should they do?
Any therapist that's worth their weight in salt would do, like I said before, an assessment. And the assessment should flesh out what is the overwhelming issue the person is dealing with. So take myself, for example. I don't work with active addicts. I'm not a substance abuse expert. So if I were to get a client and I assess that substance abuse is far more prominent in their life than the mental health issues, because you can have both. You can have a mental health issue and you can be a substance abuser, or you can be one or the other. So if this person is actively using a substance, then I will send them to a colleague that is a substance abuse specialist. And that person would then be seeing that person for the substance abuse issue and me for the mental health issue. And in the same sense, I've assessed clients and realized that it was mental retardation or developmental delay more so than mental illness. Like I had a 15-year-old girl that was hypersexual, and she was having sex everywhere, anywhere, school, church, home, and she was being parented by a single father parent. And she'd been kicked out of school, everything. So when she came to me, we did the assessment and I talked to her. Probably about the third visit, I was very puzzled, because one of the things that got me in the very first session was when I asked being so promiscuous, I said, "You must really like sex." And she looked at me and she said, "No." So that startled me because I did not expect that. And so I said, "No." And that started me thinking. And so the second session, she was having sex. And by the third session, I knew she needed to have a psychological assessment that far exceeded the one that I do. And I sent her out to get that done by someone that does a month-long intensive assessment. That's another specialty, because I do a one who specializes in testing only. And so we had to wait for about 2 months. The test came back. She was mentally retarded, mentally delayed. She was 15, functioning on an 8-year level. She was actually 8 years old. And 8-year-olds don't like sex. They don't even want to have sex, because she was in a 15-year-old body. That, however, no to that question started me, because she did not come off as mentally slow. She didn't have any of the physical markings. She carried a conversation at a decent level, though when I started getting deeper into what's going on. And that one question started me going down another road because no was not the answer I was expecting. Remember those norms I was telling you about in that place where we start off? Yes, you would expect her to say yes if she was having that much sex as a 15-year-old. But because she was actually an 8-year-old, the no made sense. Not this far with her. They missed it. They missed it. They had her as mentally ill when she was mentally retarded. She was developmentally delayed. Do you understand? So
Yeah,
she
I did
absolutely had to
understand.
be sent somewhere. I was not the person to help her. So she had to go to another specialist.
So when one is, like you look online and you look at your healthcare plan and you're looking up psychiatrists, um, do you then just pick one and then you are referred to one that specializes in is that the norm?
Okay, the first thing is a psychiatrist
Okay.
is is the MD. He or she is the doctor, and I'm a psychologist or a
Uh,
therapist, right? And so that's the biggest difference. Then there is the psychologist who is a PhD that does not have clinical training. They teach, they write books, you see, they teach at the university because they have a PhD. I have a MA with a clinical degree, right? The doctor, the psychiatrist, has an MD specializing in psychiatry. So if you were to go to a psychiatrist, he or she could give you an assessment. They will then send you to someone like myself who is clinically trained to do the treatment, to do the sessions. And like I said, if I found someone that needed more intense testing, I'd probably send them to a person who's a PhD who does testing. And you have PhDs, they only do classroom work or they do research. So that goes back to what you were saying with the difference in dentistry, all different kinds. And so I would say start off with a psychiatrist if you'd like. He or she is not going to do the therapy. Or the most important thing is make sure the person is licensed in the state that you're living in. Every state has a Secretary of State website, and that's where our licensure comes from. And so you make sure that person's license, you make sure it's a clinical license, not an academic license to teach. And that person should then be able to do the assessment and help you know what the direction you should go in. So that's what I would suggest. Look for the licensure or look for a psychiatrist who is an MD. Does that make sense?
yes, that makes sense. And I'm so glad I asked that question because I know I'm not the only one that's confused about that.
Yeah, and that's confusing.
Another Yeah, it can become confusing, especially the normal person usually just go online, look at their insurance and try to find someone. So I'm glad you clarified that. Um, One of the things that I have personally run into that I find that it's not diagnosed as mental illness is anxiety, chronic anxiety. And I ran into this over the years with a couple of people that I assisted. And this anxiety has led individuals to shoplift. And I found that a lot of these individuals, they end up in jail over and over and over again. And no one ever get to the root cause. And over the years, I realized that there is not like help. You have substance abuse, you go to the substance abuse um, group, there is no specific that I found for people with severe anxiety that enables them to go in and out of jail all the time for that anxiety. Is there
Well,
anything that you know of that could possibly help those kind of people?
oh, absolutely. Positively beyond a shadow of a doubt. Anxiety is one of the leading mental illnesses there is. So, first of all, absolutely. If someone is diagnosed with with anxiety, they would have had to been diagnosed by a professional. Again, a clinical professional. And if that person has been diagnosed, then the therapist should have given them a treatment plan. Now, whether or not the person is following the treatment plan would be the issue. Probably 60% of my clients have anxiety. And sometimes anxiety and depression go hand in hand. I've been diagnosed with both since my early 20s, and I manage them very differently because they present themselves very differently. And what you're talking about are some of the adverse um, responses of undiagnosed, unmedicated mental illness. The diagnosis of anxiety is one that can be treated with or without medication. Absolutely, it has to be put on a treatment plan. I have several skills that I've gained over the years to work with my anxiety and to work with my depression. I've also learned over the years how to recognize what triggers my anxiety and what triggers my depression. And I absolutely, over the years, have been on medication. And again, I talk about it, in mixed company. I talk about it on Zoom presentations. I talk about it wherever I go because I'm not ashamed. It doesn't take away from my professional ability to be one of the most committed therapists that I know, because that is my commitment, is to be present and to be there and to do as much as I can to help our community become mentally stable, which equals to being able to manage whatever diagnosis we have. Because I don't know of a cure at this point. So I tell people all the time, it's not about getting cured, it's about gaining the skills to manage your diagnosis. And I stand firm that there is a method in which you can learn to manage. I didn't say it was easy. I didn't say it was a trick. I didn't say it was magic. And I didn't say it happens overnight. However, I absolutely have been managing mine since I was diagnosed because I want to be healthy. I want to be productive. I want to be an active part of society.
So, in those instances of severe anxiety, they still need to start with a psychologist.
Well, a psychologist or a psychiatrist. What you have to get is a professional assessment. They have some places, and again, this is the US more so, and I'm working on getting all of that to happen in Guyana. They have places here in the U.S. where they have clinics, they have the community service board, they have hospitals here in Georgia. It's Peachford, Riverwood, Ridgeview, to name a few, where you can walk into their assessment off the street and say, I want to get an assessment. And they will give it to you most times for free. I know Ridgeview, which is in Smyrna, they're open 24 hours a day, 7 days a week, and they do assessments for free. It's Ridgeview Institute in Smyrna. And they don't care where you live, they don't care, anything. You need to be an adult. If you're taking a child, anyone that's younger than 18, then that child has to be accompanied by a custodial adult, not just any adult, a custodial adult. And if you are 18 or over, you can take yourself there. Peachford, even Grady, definitely Riverwood. What's the other one? I can't think of all the other ones, but there, you just need to Google mental health facilities or mental health assessments, and it'll tell you where you can go to get one. That is the place to start.
Okay. Is there like a, we just need to Google it because I've looked for individuals and was not able to find one. So I guess I
Yes,
will
not with
just
the
look that
hospital.
up and find
Yeah.
a listing
Well,
for
if you
individuals.
well, if you have health insurance, most health insurance now has they can call it mental health or behavioral health. That's another new term, behavioral health.
Oh,
That's the same. That is the
okay.
same as mental health. Behavioral health is the same. So most insurances cover that. And so if you go into your, I'm sure everything's online now. If you go into your insurance company like Blue Cross Blue Shield and you put in mental health therapist or behavioral health, then it should be a list in your zip code. Usually that's how they break it down, where you can call and set up an appointment. If you don't have insurance, then like I said, every county in Georgia has a community service board, CSB, Community Service Board. And the Community Service Board is just that. It services the community, and you are treated financially based on your ability to pay. So it's what's called a sliding scale. And if you can't pay anything, then you pay nothing. Though they have everything at the Community Service Board from mental health to dental health. You can go there, have a baby or have a tooth taken out or do mental health therapy. Everything is at the Community Service Board in every county in the state of Georgia.
Oh, wow. That is good information to know, especially, with so many people being laid off from their job and so forth and might not have insurance. So this is very good information.
Yes.
Which brings me to the topic of, speaking of online, I noticed that a lot of the therapy right now are being conducted online. What about those people that are, they're not so online savvy? They don't want to be online. They want to face to face. What should those individuals do right now? With the pandemic still going on, even though we're open, but it's, still present.
Yes, and absolutely. 2020 brought challenges for every person, I would even say, on the planet. Um, and when it comes to mental stability, I think that was one of the most hardest hit industry, because just like you're saying, even the people who were going to therapy face to face prior to, and they had become comfortable with that had to stop. So there was some very high crisis levels of situations, some that I was involved in, some that I read about, some that I heard about. So at that point, a therapist would have to make a decision whether or not the person was safe. And then that person, if deemed not safe, would have to be hospitalized, because we could not leave these people out without us being able to go see them. So that's one part of it. And if you are a new client, and it was again a touch and go situation, it was hard call. It was no boiler point. There was no precedent, so no one had a rule. Though we had to decide during our assessment whether or not this person could be seen over the phone. Um, and at this point, you really have a choice now, like 2021, because I'm open to seeing people at the park. That's social distances. I'm open to seeing people where they're comfortable if they really need that real face to face. There's quite a few people who have become very comfortable with the Zoom. And so that helps a lot of people, because I still go to therapy. So I saw my therapist over Zoom. We've never to this day met face to face because they were new therapist that I just started with in 2021. So all of my therapy with them has been, and I've never done over the phone or over Zoom therapy before now. I've never done that. As a patient, I've done it as a therapist because some people prefer that. For me, I've always liked going face to face. So it goes back to the same thing. We have to be professional enough and clinical enough to make a decision, because at the level where I am, I can call and say to the police, I need you to go pick up this person and take him to the hospital. And they will do that, because you can be placed in the hospital. It's called a 1013 against your will. And the law says that you can be held for up to 72 hours. After 72 hours, you have to substantiate why that person could not be released. And of course, I've done that several times, because if I deem a person not safe, then that is my moral, legal, ethical decision, is to make sure that they are safe. And sometimes it means against their will.
Very good. Now, I know we only had 45 minutes, but I have a really important last question that I thought I should touch on. Mental illness and policing. If someone has a mental illness, and just say they suffer from severe anxiety, right? They get pulled over with the car by the police. And in today's society, we know all the things that are going on. Do you know if, say, the police are equipped, or should someone with a mental illness or anxiety do anything in particular to lessen that anxiety when pulled over by the police?
Okay, that's a multifaceted question. So
Is there anything they can do?
yeah. Well, first of all, the police, from my experience, and I've worked with police departments before, they are not, they're not skilled. I'm even surprised that teachers aren't skilled. I've worked in the school system before, and I was appalled.
Wow.
I was like, huh? So it's not a requirement. And especially when you're talking about early childhood education, how could you not teach the developmental traits that you need to know to see if this child has an issue? Anyway, I get off that box. And when it comes to the police, then no, they're not trained. Now, when it comes to the person, it goes back to the same thing. My question would be, is that person diagnosed? Is that person medicated? Is that person aware of their diagnosis? Are they in treatment? All of that will play into what they can do. So if this person is not any of that, then it becomes a very dangerous situation, because when your anxiety is triggered, depending upon your own particular profile, because remember, everybody's different. And we talked early on about trauma being trauma, and everybody's trauma is not the same. And there's no, good trauma, bad trauma, heavy trauma, light trauma. It's just trauma. So if your mental illness presents itself in an aggressive way in your behavior and you're triggered, yes, your aggression will not be understood as mental illness. It won't be. So if you're unable to say, because I have had experiences personally at an airport one time when I was in a crunch, and the woman behind the counter was so rude. And she basically said, I don't care if you miss your plane. For whatever reason that day, it triggered my anxiety, and I bust out crying at the ticket counter. And everybody looked at me. And so the person came from nowhere and was hugging me and had on a suit and a walkie-talkie and all this. And I said to the person, I said, I'm fine. I know I'm crying in the middle of the airport. I have extreme anxiety. And she was extremely rude. So if you would help me to get to a seat, and I should be able to calm myself down. Right now, I am not able to do that by myself. And they did that. And what happened after that was even funnier, because they gave me priority seating on the plane. It's like, let's get this woman on the plane first. And I wasn't even trying to do that. So, however, I know me. And I knew what was happening, and I knew what I needed. And again, I was not embarrassed. I was not ashamed. I needed help. And once I calmed myself down, I was calm. And they still, you know, an hour later when it was time to leave, they still gave me priority seating. And so, you know, that's the best answer. I wish that at some point, like the emergency bracelets they have, I wish we can get some of that going on too, where it could say I have anxiety, or I have this, if I'm behaving this way, this is what I need, you know, because sometimes you aren't able to verbalize it, you know, and it takes a lot of training. That's going to therapy, getting the right work to get the skills to manage it, because we see it in every facet of our lives and at most every developmental age. I just wish we could help it at the earliest developmental age possible, and we will begin to see it decrease as we grow.
Thank you so much, Ms. Colena Brown. You've been quite helpful. And I just want to say also, in the state of Georgia, we have a non-emergency number that people can call for things like mental illness. It's 311. So, you know, instead of calling the police, call 311. I don't know for the other states, but in Georgia, it's 311. Is there any information you would like to give to the public in order to reach you, or, you know,
Well, I am in Georgia. However, I will be going back to Guyana in September. So I spend the summers here in the US, and I spend the winter and the fall in Guyana. However, I am quite open to sharing my phone number. I closed my practice in 2016 when I moved to Guyana, though my phone number is 702 427 9368. And if anyone chooses to call, I'll do my best to help and or refer.
that is so wonderful. And again, it's 311 for Georgia for non-emergency, anything, you know, like mental health and so forth, instead of calling the police. And if you find that, you know, you're in need of some help, call 311. Thank you so much, Miss Brown. It's been a pleasure talking to you. I learned a lot.
All right. Thank you so much for having me. And absolutely, whenever you need me again, just call.
Thank you.
Bye
Have a
bye.
good day. And now we end this segment of mental illness. See you tonight at 7 p.m. with the men. Yes, the men will be on at 7 p.m. tonight.
Thank you so much. It was a wonderful conversation. I'm really great we got this done. And yes, the men will be on tonight. It was a very great conversation last year. And we women will be flies on the wall just listening. And I'm looking forward to see what happens tonight. So thank you so much again, Christine Newton and Miss Colena Brown. Thank you for your work. Take care.
Thank you.
Bye-bye.
Bye
Have
bye.
a good day. Bye bye.